Hi, I am PK Srivastava, working as Joint Director in National Vector-Borne Disease Control Program under Ministry of Health and Family Welfare, Government of India. I am working for elimination of lymphatic filariasis, which is targeted for elimination in the country by 2015, and globally this disease is targeted for elimination in 2020.
Today we will talk on elimination of lymphatic filariasis. Lymphatic filariasis is the disease which is commonly known as lymphatic, or sometimes we see in male population with hydrocele. It is a major social stigma, and this disease has been targeted for elimination globally, which is prevalent now in 83 countries, out of which some countries have already eliminated, and India is one of them which is still waiting for elimination. In India, this disease has been targeted for elimination by the year 2015. There are some strategy which is based on scientific background, and let us discuss on the science behind the lymphatic filariasis elimination program, the concept on which this program has been designed. This disease causes leg swelling. Persons affected, they feel recurrent attacks. There are wage loss. They are unable to participate in social functions like marriages, like cultural functions. And once the people is affected, there is no hope of cure. There are some photographs which will tell you the story and the consequences at late stages in the society, when the people are really thrown out and there is nobody to take care of them. Globally, as I told, that the whole world, 1.2 billion population are at risk. Out of this, 600 million population, roughly half of the global population at risk, is living in India, which means if India succeeds in elimination program, the global program to eliminate lymphatic filariasis will definitely have a success. There are man days loss in earning, there is productivity loss. The scientific study has worked out that there are annual loss to India is roughly around $1.5 billion. And when we will be talking in detail, we will understand that the drug which is required for giving the preventive dose, total cost of implementation is ₹1, which is very cheap in comparison to the total loss incurred towards the country and the productivity of the country. The marriages are affected due to social stigma. Especially you can have a look if young female child is having swollen legs due to lymphatic filariasis, it will definitely affect the marriage and the negotiations of marriage. It has got its own societal reactions. Sometimes at late stages, it creates sexual disability also. Now, if we want to understand global program for elimination of lymphatic filariasis, we must understand that for any of the vector-borne diseases, this disease also, because transmitted by mosquito, we have to interrupt the transmission. Once we are thinking of interruption of transmission, that is basically to prevent the spread of the disease to the individuals from infected ones and to the future generation which we are aiming to be free from this disease. But simultaneously, in like other chronic diseases, this disease also we have to control the morbidity, because those swellings of the legs at late stages cannot be regressed. Second thing, that it is a disease of the poor persons, so they cannot afford to go for very costly treatments, which also does not help fully. So we have to do something for morbidity control, which means that the global program to eliminate lymphatic filariasis has to have both the components, one for interruption of transmission and second for morbidity management. Now, once this program is launched, this indicates that the hope which we lost long back, now there is a hope, and the hope arises when the program is conceptualized on understanding the parasite, the pathogenesis, the newer tools, the alleviation tools for morbidity management, and new chemotherapeutic tools. Now, if we start one by one to understand the parasite, we must understand the life cycle of the transmission of lymphatic filariasis. This disease is transmitted by mosquito, which is known as Culex quinquefasciatus, mainly for Wuchereria bankrupti, which is the causative agent. Now, mosquito picks up the baby filaria worm, which is known as microfilaria, and when mosquito takes the blood meal from the infected persons, it sucks those microfilariae. They come out of the stomach, reach to thoracic muscle of the mosquito, and there they develop. Through molting process, they become mature, and from larval stage 1, they reach to larval stage 3. From there, these larvae, they coil on the upper portion of proboscis of mosquitoes, and while mosquito is biting to other person, they are dropped on the skin. From there, they get entry into the human system, and there these larvae develop in the lymphatic system of human body. The adult female worm mates with the male, and after that the female worm starts producing microfilaria, which later migrate to our peripheral circulatory system. Now, once we understand that the adult worm, which has settled in our body after mating and starts producing microfilaria, what are the damage they do within our body? If we look on the pathogenesis, this is known as this disease is acquired in childhood, and there are different methods through which we can know that whether the disease has already been contracted in younger age group. Even if smaller swellings will give some indication, but the test which we have to do is known as lymphoscintigraphy, and recent studies have proved that even the age of 3 years, 2 years old children, they can show some lymphatic dysfunction. The adult worm which live in our lymphatic system cause dilatations. We have to remember that initial stages it is not obstruction, which was the concept known earlier. Now this dilatation which is done in lymphatic system, it causes dysfunction. That means that the fluid flow is sluggish and the transport of bacteria to lymph nodes is impaired. Therefore, the bacteria multiply in the tissue which is flowing sluggish. Now, there are some kind of manifestations which we see. There is one photograph which shows on the upper arm, below the arrow, if you see, there is a red streak. This is because of dead worm, and the pain during this acute stage is so acute, so painful, that it's very difficult to bear. Slowly, when the infection proceeds, the acute dermatolymphangioadenitis symptom is seen. It means that there will be redness on the skin. The external bacterial infection will be superimposed on those places. These places are known as entry lesions. You can see in the photos. These requires proper care. Now, how to diagnose these things and relate with our lymphatic filariasis infection for prevention or treatment? There are different methods. The rapid assessment procedures are precisely meant through physical examination by health workers. Then, because this disease is related with social stigma, it is the key informants who will help in telling that in their neighborhood somebody is affected, somebody is having swollen legs, or somebody is having hydrocele, which they may not tell because of social stigma. There are set designs of questionnaires which can be asked by the health workers through the key informants who can give some kind of clue, and we can note down and we can find out what is the magnitude of the affected people in that area. There are some sophisticated DNA-based diagnostic tools like PCR. Then there are tests which will tell about the presence of adult worm in the body through circulating antigen detection assays, which is by and large done by immunochromatographic test, commonly shortly known as ICT. Then to know the microfilaria, that is baby filaria in the blood, we have to test through a blood smear, which is examined under microscope. In case of scanty infection, we have to use the concentration method or membrane filtration technique. But in field, we usually do the night blood smear test. Now, the ICT card is just like other rapid card test, where the antigen antibody reactions are taken place, and once we put the blood on the proper strip, after some time, that usually we assay after 10 minutes, the band is seen, and if single band is seen, it is negative, but if double band is seen clearly, it is the positive, indicating the presence of adult worm. Now, this is for the testing the parasite in the body, but those who have been affected, our aim is to provide the disability alleviation through morbidity management. How to do about that? Now, the people affected will have pain, so to relieve the pain, we have to provide some drug. Now, there are cold compression, there are rest in the acute stages. We do not recommend any kind of exercise. We have to do the leg elevation exercise while sleeping. They should put at least 2 brick height on the bedside and where they can put their leg. Plenty of fluids they must take, and in case of fever, they are recommended to take antipyretics. But above all, the hygiene and care for entry lesions, which we showed you earlier, is very, very important, and it should be resorted as soon as it is not paining. Now, to maintain the hygiene, they should wash their legs completely and dry it to avoid humidity or moisture on the wound. There are demonstration techniques how to do it. You can have a gathering at subcenter, you can have a gathering or PHC level, you can have a gathering in the community level where some of the health worker can give a demonstration to them how to wash, and then you can provide as a token to the patients as a gift where they can start practicing at home, and that kit is known as morbidity management kit, which includes a small bucket or mug with a small soft towel and a soap. The antibacterial cream or antifungal cream can always be provided through the existing health delivery system. Now, there are some patients where the legs are swollen too much, where they cannot do of them their own. There they require help, and the neighbors or the residents or their own kith and kin, they should try to help such kind of patients. It has been observed that it definitely improves the living condition of those patients. Now, the chemotherapy to treat the patients is known, but what can be done for elimination? If the dose as per textbook is 21 days with antifilarial drug, that is known as diethyl carbamazine citrate, commonly known as DEC, but that is only to the diagnosed patients who are having microfilaria. To eliminate, the concept of the chemotherapy was have preventive chemotherapy. Now, what are the choices with us? We have learned that there are two stages involved. One is adult worm, which is producing microfilaria, and the other microfilaria, which is picked up by the mosquito and transmitted to other healthy persons to continue the transmission in the area. Now, for the drug, we have DEC, we have another drug known as ivermectin, we have another drug, broad antihelminthic drug, that is albendazole. Now, DEC, the advantage is that this drug is known for us for 4 decades. The action is, though not fully understood, but it helps. And the program, it is being used since 1955, but the dose recommended for full treatment is 12 days. Usually there is no reaction with the drug in healthy people, but those who are harboring microfilaria, they can show some reactions because of death of microfilaria after taking this drug. The drug can also be used as mass administration because we know about this drug. Now, scientifically also it has been proved that DEC, which has got a dose of 6 mg per kg body weight, if you give once or you give 12 days, almost the results comes to the same. So we can always take a decision that to have a reduction in microfilaria level at community level, we can always prefer to give DEC for single dose instead of continuing for 12 dose. It has also got some effect on adult worm, which has been seen recently in scientific publication, that they did try with 1 mg per kg, 6 mg per kg and 12 mg per kg body weight. And if you club together with single dose DEC, you see that there are some 50% mortality in worm death. Even if it is not 100% mortality, the fecundity is affected, which has got an impact on production of microfilaria. And the basic aim of prevention program is to reduce microfilaria level to less than 1% in community, with the concept that transmission will slowly be reduced and further reduced, and the disease will die its natural death. Now, when we are talking of some side effects in the microfilaria carriers, what are those side effects? Usually, there will be fever, there will be headache, there will be some drowsiness, or there will be some kind of gastritis or nausea. Now, these reactions are not very acute and it subsides. So, if you take plenty of water, usually it subsides within 2 to 3 days. So, what is the conclusion? That we have got a tool for mass chemotherapy. The drugs can be given once in a year, which is proved scientifically. They are already in use and in clinical practice. Even for tropical pulmonary eosinophilia, we are giving DEC. It can be distributed by the community volunteers because the primary health care system is very robust in the country. And side effects, those seen in some microfilaria carriers, can easily be managed. Now, once we have got 3 medicines, what best options can be used? We can use single dose, we can use DEC plus ivermectin, we can use DEC plus albendazole, we can use ivermectin plus albendazole, or we can use DEC medicated salt. But we have taken a decision in our country, as per the global policy, that we will be using DEC plus albendazole, which has been scientifically tested after 5 years of trial, that DEC albendazole combination has edge over single dose DEC alone. We are not using in the program ivermectin because ivermectin is being used in those countries where DEC cannot be used due to presence of onchocerciasis and loa, where DEC has got a very serious reactions. Now, once we have taken a decision that we will be using DEC plus albendazole once a year as a mass administration for the population living at the risk of lymphatic filariasis, we must understand and know that the whole success of reduction of microfilaria through mass administration will depend only on high coverage, at least above 85% of the population, and it should be sustained for minimum 5 to 7 years, for which there are different modalities. You have to convince the people, you have to go to the community, because here the question basically asked is why healthy people should take when they do not have any sign and symptoms. So it is not directly related with the disease and the perception is not there. So you have to have more IEC, and that is why there was a slogan that use more IEC, less DEC. You have to understand that if the coverage is less than 85%, you have to have more number of rounds. That choice we cannot advocate, and that is proven scientifically. The one graph will show that number of rounds increases if the coverage percentage is less. Now, there are examples of supervised drug administration where you have not to distribute the drug, but in front of your presence, you should ask the people to swallow the drugs. It should not be taken empty stomach. There should be something in the food, and after that they can take the drug. There are fixed doses of the DEC and albendazole for the program use only, which is known as streamlined doses, and that is from 2 to 5 years. It is DEC 100 milligram, 1 tablet plus 1 tablet of albendazole 400 mg. For 6 to 14 years, it is DEC 100 milligram 2 tablets plus albendazole 1 tablet 400 milligram. Then for people above 14 years of age should take DEC 100 milligram 3 tablets plus 1 tablet of albendazole 400 milligram. We in the program do not advocate to give the drugs to the children less than 2 years because they will qualify after 2 years for next 3-4 rounds. We do not advocate also to give drugs to the pregnant women to avoid any kind of fear psychosis or complication and get the program be blamed. We also do not advocate to give the drug to the seriously ill persons, and the seriously ill persons means that the people who are having complicated and chronic problems, who are already on the medication like heart problem, some neurological problem, some kidney problem, blood pressure problem, they can always take this drug under clinical supervision, but in a program of such a massive scale, we do not recommend to give the drugs to those people to avoid any kind of disinformation or rumors spreading out of some kind of bad concept or bad perception. How the success will be achieved with more than 85%? It starts right from top. There has to be political commitment, and in a country like India, there is political commitment. The health ministers of Government of India, the state health ministers, then administratively the policy makers, the decision makers, they have to show their commitment, priority to the program, take the review, support the program in mobilizing the resources, in mobilizing the finances. Then there has to be community participation. They come under the recipient category, where they must be convinced why they should participate in this program, and the country or the national pride they must support by just consuming one single dose once in a year for at least 5 years. And then to achieve all these three things, the maximum advocacy for minimum 1 month period during the elimination campaign should be done, so that everybody understands that this program is coming and being implemented for their own benefit. There are some photographs where Union Health Minister, Chief Ministers of the state, and health ministers of different states, plus there are some photographs which shows different kind of IEC and BCC activities, where general health mela and congregations of people at different places have been addressed why they should take drug. The whole aim of this teaching is that if you see the old man which is having affected lymphedema at the leg, we do not want that our future generation should contract this disease. So the child on the top is shown who is grandson, and we want that future generation should be free from lymphatic filariasis.